Hi everyone, I'm Dr. Adele Ng. I'm an ENT surgeon at Singapore General Hospital. If you have been diagnosed with obstructive sleep apnea and have been prescribed a CPAP machine, it is important to know how to use it properly. Obstructive sleep apnea or OSA is a condition that is caused by repeated upper airway obstruction during sleep. What happens is that during sleep, muscles controlling the upper airway relax, leading to collapse or narrowing of the airway, and this in turn leads to a decrease in oxygen levels in the blood. Symptoms of OSA include snoring, excessive daytime sleepiness, choking or breathing pauses during sleep. A sleep study is required to diagnose OSA, and continuous positive airway pressure therapy, also known as CPAP, is the gold standard and most effective non-surgical treatment for OSA. The CPAP machine uses gentle air pressure to keep your airways continuously open during sleep, allowing you to breathe better. Benefits of CPAP include elimination or reduction of snoring, better sleep for yourself and your bed partner, feeling more rested and refreshed in the day, and improved memory and cognition. Consistent use of CPAP also reduces the risk of stroke and heart disease and helps to control your blood pressure. Our sleep technologist Yun Hwee will tell you more about the CPAP machine.
Hi, my name is Yun Hwee. I'm a sleep technologist from Changi General Hospital. I have with me here a CPAP machine as well as the tubing. The tubing connects from the machine to your mask. The CPAP machine pumps the surrounding air into your respiratory tract when you sleep at night. It has two modes. The first being the automatic mode, where it will automatically increase the pressure when you sleep at night. The second mode being the fixed pressure mode. The fixed pressure mode pumps in a constant pressure of air when you sleep at night. Next, there's a humidifier at the end of the CPAP machine. This might help you with any dry mouth or dry throat issues. Step 1. Place the CPAP machine at the same height as your bed. Step 2. Check that there is a power socket nearby. Switch on the CPAP machine. Step 3. Allow the CPAP machine to start up. Step 4. If your humidifier function is switched on, remove the humidifier and add water until it is below the maximum line as indicated. Step 5. Connect the tubing to the CPAP machine. Step 6. Wear the mask. Use one hand to hold the mouthpiece to your face, while the other hand holds the thicker part of the mask straps. Pull it over the head such that the thicker strap is at the back of the head, and that the thinner strap is at the top of the head. Next, clip the straps to the frame. Tighten your mask to your comfort, making sure there is a proper seal between the mask and your face so as to minimize air leakage. You might need a mirror to practice this to familiarize yourself with your mask. Step 7. Connect the mask to the tubing. Step 8. Switch on the CPAP machine and fall asleep with it for at least 4 hours to see results. Also, remember to tighten the mask to ensure no leakage. Good night! Maintenance. Wipe the mask every morning after you have woken up with an alcohol-free wet tissue. Ensure to use hand soap instead of detergent. Hand wash the mask once every week or month, depending on your free time. And allow the mask to air dry instead of drying it under the sun, as it might damage the silicone or even shrink the mask. If you are using the humidifier function, remember to change the water daily with normal tap water. Maintain your CPAP every 6 months by bringing it to your vendor for preventive maintenance and servicing. These tips will allow you to use your mask and machine for a long time. One of the common issues that patients face is having trouble or finding it difficult to exhale. Try to use the CPAP when you are awake to get used to the feeling of using the device. Sometimes, you may also experience blocked nose. Some patients have also complained of having pain in the nose or ear. In this case, we would advise you to stop the CPAP treatment and consult a doctor first.
We hope you found this video helpful. The use of CPAP improves your sleep quality and reduces the health risks associated with OSA. For more information on OSA or CPAP, speak to your care team.